that smile because every time we start, I have this really weird facial expression that am not a fan of. So
I know this one.
oh, we're starting. Have a nice look. So how are you doing? How we're waiting for everyone to come on?
Well, I got stung by a yellow jacket 2 days ago, and my arm is now like finally normal, but it was like this big, huge, like swollen, like a Popeye forearm almost that I had.
Gosh.
And no one cared. I was like, I got stung by a yellow jacket. Everybody's like, when's dinner? You know, I was like, but my yellow jacket sting. And they just
cared
about it. Yeah, they didn't want to talk about it. They were just like, you'll be fine.
Oh my gosh.
I know. But I guess, I don't know.
Well, I'm excited that we're getting ready to do our show, and we're going to wait a few minutes. I see there's a couple people on, but we definitely wanted to start our show when we have everybody on, because I think it's going to be a really exciting topic today.
Yeah, I'm excited because we're talking about bringing home baby, that newborn survival guide. Those of us that have babies, at least one, you've been through this bringing home baby, and you know that survival guide is exactly what you need, because you need to just survive.
Oh, definitely survival guide, because I mean, we're definitely talking to the mamas out there that got their brand new babies, to the mamas out there that have already been through the new babies but can totally relate. And then, of course, the moms that are about to have their new babies. This will be the best information for you, because, they don't come home with a handbook. I don't know why our newborns don't come home with a handbook. I think somehow the hospital should release them with a handbook, but they don't do that. And that's definitely something that I think us new moms realize, that we run into a few things that first few days, those first few weeks, where we're like, I don't know, what am I doing? How do I do this?
That is so true. And even if there was a handbook, it would be different for every baby. Like, we'd have to customize it for each baby, because I know even between my kiddos, I had different experiences with all of them. So that first week, we're really getting to know each other. What does my baby's hunger cues look like? Do they suck on their little fist like this? Do they kind of root to the side? How do I figure out what my baby's trying to tell me? We need to get to know each other.
Yeah, you have to learn their cries. You have to learn what is I need diaper changed, what is I'm starving. Well, wait, not what is I'm hungry, and then what is I'm starving, because there is a difference. There is a difference.
So we are going to get into a lot of great stuff here today. We've got some products to give away. So stick around. The first question I wanted to ask you moms, Tobi and I talked about this, was dressing your baby. So we all get these totally adorable outfits, right, at our baby showers and when we shop for ourselves. How long did you dress your baby in denim jackets, sweaters, and shoes, little jeans?
Let's not mention the shoes that you have to.
And the shoes, yeah.
The shoes. So I know for me, I would love to hear your stories, mamas, about how long you dress them in these very interesting, unique, awesome, but really not
super practical
clothing for your 1 day old or your 1 week old. Because I know for me, I think I did it for the first probably week, and then after that, I was like, this is ridiculous, crazy. And I think I had some blowouts where you didn't transition to the newer diaper or the next stage up diaper, right? Yeah. So the poo came out the side and up the back, and you're trying to, fight with your baby to get all that off, and you realize a onesie or just that dress onesie is the best thing ever. Not cute, but the best thing ever.
The best thing. And my kids, they all spit up a lot. So either like be vomiting actively, or this milk would be dripping passively out the sides of their mouth at all times. So, I had milk everywhere, all over me, all over my furniture. but then also anything they wore. I mean, I changed their outfits so many times every day because they would just be milk soaked. So it just,
and it's so funny because you get, and shout it out, mamas, give me some thumbs up or some,
yeah.
oh yes. You get or the newborn clothing that I think sometimes doesn't fit your baby at all when you bring home your 10-pound baby that is not the size of the newborn clothing, or it only fits for maybe a week. And then you're trying to get all those clothing at least worn once, and and your baby like has this growth spurt that you're like, oh,
those too small for you now. Yeah. We've got a lot of great comments. Felicia said that she'd take her baby to the doctor and they would undress the baby. And that took her like probably about 20 minutes to dress the baby before she went to the doctor. And then it was undress, and then you got to do all that work again.
Felicia, they were, and you know what? Your pediatrician is just not impressed with what your baby's wearing, are they?
I know.
You're expecting awesome comments, and you're trying to put bows. Now, my daughter was born bald, so I never got the ability to do those cute little bows in the beginning. I tried doing the little like headbands, but it looked like it looked like a tourniquet on her head. So then I felt like, I don't think I should do that. Maybe I should take that off.
That looks weird.
But they won't. They're not impressed. And then, of course, your baby is not impressed at all. They're screaming and hollering, and they're wanting you to hurry up and get the clothing off or hurry up and put the clothing on. And they're just not impressed. They're not.
No, my kids were never comfortable with any hats or anything like that. And I was so bummed. I'm like, that's so cute. Just keep it on. Or don't cry when I put it on you. But no, it was like, they were not comfortable. And I love all your comments. We have some, Shania said that her son is normally naked unless we go somewhere. Yeah, I think that was my kids too. They spent a lot of time.
Yeah, definitely.
Clothing, as they say.
So that's a good key point for new mamas to know that we don't want to take away the fun of these amazing, adorable clothing. But the reality is you might not use them as much, so don't go crazy and buy like 50 of them because they'll end up being in a onesie or naked. Yeah. That'll be it.
And I remember getting my son an outfit for pictures, right? To get, we're a family of 3. He spits up all over everything. I mean, it was immediately, as soon as I put it on him, I was so excited. You're going to wear this. It's going to be such a cute picture. And then he spit up over everything, and then took him for his 1-year-old pictures. Got this cute little one that he's holding. Somehow he peed out the side of his diaper and all down his hands. So if you go for pictures, mamas,
bring extra
clothing. A veteran telling you, do not change into the clothing until you're at the picture studio.
Yes.
There you go. Do not change home and then take them there. Put them in whatever they're wearing and then bring them to the studio and then put the cute little outfits on them. Because otherwise you'll be disappointed just like I was. So
yeah, great advice, Helen. Great advice.
Make your life easier.
So what's our next bullet point? Because I know we have so much, because bringing home a baby is definitely, I personally think, especially when it's your first one, a terrifying experience.
So what was your expectation versus reality? So for me, I really didn't have a lot of expectation. I had taken childbirth education classes, so I kind of had an idea, like clinically, what this should be like.
You studied to bring home your baby. That's cheating, Helen. That's cheating.
But in reality, it was a lot different. I was actually very grateful my baby seemed to sleep, although he slept in small intervals. He would sleep, he would go to sleep after I fed him, which I was very grateful. I think babies are designed to sleep a lot to help us, right? To like make it a little bit easier that this baby might be up around the clock, like every hour or 2, but at least we're getting some shut-eye here and there. So
I think I had a lot of expectations that were all wrong. Or at least my daughter never followed whatever I thought the expectation was going to be. And I'm sure there's a lot of mamas out there that are right there with me, that they kind of pre-thought either the worst or the best, and their baby never lived up to either of those. I wasn't prepared for my daughter to sleep actually as much. I didn't study like you. I didn't take a class. I took a breastfeeding class prior to having my daughter, which I do think, and I know we're going to talk about that in a minute, but I do think that is something very important for moms to do. You think, why do I need a class? But you really do. But I didn't take a class about what to expect when you bring your baby home. So I kind of thought that they didn't sleep, at least that first week, maybe two. I didn't really think that they slept all the time, except for when it's time to eat or time to change. I wasn't expecting that. So by day two, I started kind of worrying, and I'm a paramedic, as everybody knows. And you would think that I know about this. Well, we definitely learn about pediatrics, but not bringing home your newborn and raising it. So I got my stethoscope out, and I wanted to listen to what her heartbeat was so that I knew what her heart rate was. And then I panicked because it was lower than what I thought it should be. And I started calling everybody, trying to figure out, is this okay? Is this not okay? And, I think people thought I was insane. Yeah, so there was some things like that. I know another one. What about you moms? Did you obsess about pooping? Like when are they pooping? If they go days without pooping, is there a problem with this concept? Because I know I obsessed about, did we poop? Did we not poop? Especially when they get a little bit older, like when you transition into like that 3-month mark. My daughter didn't poop for like 3 days. I'm calling the pediatrician saying, I've got to come in. There's something wrong with her bowels. And they were like, it's fine. She'll poop. Don't worry. Fine. No. Okay, then she's fine. And, moms tell me, did you obsess about pooping? Because I kind of obsessed about pooping.
Yeah. I did obsess about pooping too. We have some moms. Felicia said that she was surprised that her daughter breastfed. Oh, I'm sorry. Her son breastfed, is often and seated every 15 minutes and used her as a pacifier. I have been a pacifier. I know what that's like.
Let's raise your hands if you've been a pacifier, because a lot of moms need to know that actually is a normal thing. That's a normal thing. It's not.
It is a normal thing. Yeah, and it's actually great for your milk supply because you're constantly removing that milk. You're getting that nipple stimulation. So being used as a pacifier, it's not all bad. I know it takes a lot of time out of your day, and it's kind of inconvenient, especially if you have older kids. But just go with it. Don't worry about, all those things you have to do. just be a pacifier. So
I know, I don't know about you, Helen, but I think I had some preconceived notions that were maybe wrong because I had so many people giving me input, like my mom and my dad and my family and my friends that are all trying to tell you what you should and shouldn't do. And I think that sometimes makes it a challenge because you think that you might be doing something wrong. Like my dad was always like, don't hold the baby too much. Don't hold the baby too much because then you'll never be able to put the baby down. And I don't know, moms, let me know if you've heard that. Or, don't feed the baby too much because, again, you're going to make them use you as a pacifier. So you think that you shouldn't be doing that. And in those first 2 weeks, that's the critical time, I think, on really getting comfortable and learning how to breastfeed. And I think that gets in the way sometimes because I did struggle that first 2 weeks with, am I supposed to? Am I not supposed to? Am I doing too much? Am I not doing too much? And I think that was everybody else preconceived notions made it harder for me.
Yeah, I think that is the way it is sometimes, especially if you have a lot of family that is really excited. Maybe this is first grandchild, maybe this, and you're an only child. So your babies, they're it, right? For your parents. So so I think that it is kind of a challenge, especially when we have maybe older relatives that are going by outdated information. For instance, put your baby to sleep on their belly. That's what the advice used to be because the thinking was then if baby vomited or spit up, it would come out of their mouth and go onto the mattress instead of going down back into the baby. And we now know that we need to put babies to sleep on their back. because that reduces the risk of SIDS. So it can be kind of tough to have to re-educate sometimes our grandparents who are used to educating us, right? Our moms and dads are used to kind of telling us, well, this is how it's done. And then all of a sudden the roles are kind of reversed. And now you're having to kind of be the teacher and almost the new parent here, your own parents as they watch your baby. I talked to one of my friends the other day, and her grandma watched the baby, and her grandma gave this newborn baby some water and some rice cereal when my friend was at work. And my friend came home and she's like, what are you doing? Oh my God. Because this is an exclusively breastfed baby. So that was really important to her to be, continue to just exclusively feed the breast milk that she'd supplied and not kind of go off and feed these, the other baby foods that this caregiver had been feeding.
I mean, definitely back to sleep program, I think, is an awesome program. It definitely has done amazing things. Our numbers of SIDS deaths that used to be 10, 15 years ago, or even 30 years ago, are dramatically less. Learning about not having all the things in cribs, pretty much you want that was a thing. I wanted this beautiful crib with all this stuff, and really you learn all that stuff is not good. You need to have all of that out, and it needs to be the most bare bones, minimal crib that is safe for the baby. So that's definitely something, and it is a battle, because what's the first thing your parents say to you is, well, you survived, so I guess it wasn't that bad. And you're like, yes, I survived, thank goodness. Not because of you.
No thanks to you. Yes. No, I know. Tobi and I grew up, we didn't have seatbelt laws when we were kids. I don't know.
That's a good one to use, I think.
We didn't wear seatbelts when we were kids. It wasn't the law. We just didn't do that. No bike helmets. What else? I mean, it just goes on and on. And
you can use that, I think, as an example when you're talking to your mom or dad, and they're bringing up, they should be sleeping like this because of this, and they're so worried about aspiration. But moms, remember that your baby is consuming a liquid. Okay, they're not consuming solids. So even if they do spit up, they're not going to choke on that, because it has to be a solid to actually choke on something. So, it was really more of a big concern that when we're sleeping, I don't know why I'm acting like I'm sleeping with my head down, but they're baby, and they can't lift their head up to kind of move it around, and they're rebreathing exhaled air. And that's really where I think the SIDS came into play, from the smothering, as well as rebreathing air that's not the 21% oxygen, which is what we have surrounding. We exhale only 17%. So that's some of the knowledge that has come out. But you could use that example where, mom, dad, we all wear seatbelts now because we've learned that's a better choice. And you use that as an example when there's some new things coming out. But it is a challenge. It is a challenge.
So we had some questions about recovery time. So what's a normal recovery time for moms? So that question really depends on the type of birth you have. If you have a vaginal birth that was free of complications, normal recovery time is just a couple of weeks, and you can get back to your normal activity level within less than 4 weeks typically. And if you've had a C-section, however, your recovery is going to be a little bit longer, because you have an abdominal incision, and that's an abdominal surgery, essentially, a C-section.
A big abdominal surgery, actually.
Yeah. So you're going to need to take some extra time. Usually about 6 weeks of recovery time is the recommendation for a C-section. But if you've had a vaginal birth where you had a lot of trauma or a prolonged labor, those are all things that can prolong your recovery time. And really the best thing is just to listen to your body. If you're feeling exhausted and having a lot of pain in your perineum, please sit on the couch with an ice pack down there and just have your husband bring you meals and just get up to go to the bathroom.
Yes,
So,
he's like a queen. So like, okay, so I think this is what moms should know, that C-sections seem to be, unfortunately, a very common thing, but it is a major surgery. And obviously, once you're up, I think it's okay to move around. It's the getting down and back up again, the laying down and getting back up, which I think is definitely a very big challenge for moms those first few weeks, because we are trying to rest when the baby is resting. So you're constantly getting up and down, which I think has a lot of pain. And another thing, at least this is what I experienced, was that after the first like 2 weeks, they start acting like your pain levels should be decreasing. But you've got scar tissue that starts developing inside the body. And what I found was that I started getting water pockets on the inside, and it actually inhibited the healing process. So by, I think, week 4, I kept complaining to my OB, and they sent me to get an ultrasound to make sure there wasn't any unforeseen complications, which there were. I didn't have to have surgery again, but it gave me a little bit more time off of work, because it's not a predetermined 6 or 8 weeks. It's 6 to 12 weeks, depending on, do you have any complications? And this is important for moms, especially if you get time off of work, to know these parameters and to be sharing any complications with your doctors, because it could give you a little bit more time if you need that before going back to work.
Yeah, that's a really good point. Really listen to your body and don't push it, right? You need to really take care of yourself and to give yourself the time you need to recover. This is a major thing that your body's just gone through. So don't try to be superwoman and just, grit through the pain. Really listen to your body. So we had a question if we recommend childbirth and breastfeeding classes. Of course, yes. More information, always better. A lot of hospitals offer free childbirth classes and free breastfeeding classes. If your hospital doesn't offer those, there's opportunities to take them through WIC and other health departments that offer breastfeeding classes and childbirth education classes. There's also some online options that are really great as well. We know that moms that take a breastfeeding class, especially with their partner, right? So this is important. It's important that you take it. However, you have a 70% higher chance of reaching your breastfeeding goals if you take the class with your partner. So it's like having your own built-in cheerleader, your own built-in little lactation support group at home with you if your partner has taken a breastfeeding class along with you.
Now, the other thing that I wanted to suggest, because I thought that was a great suggestion, Helen, because again, your partner is going to be the person that is doing this with you. They're not physically doing the breastfeeding, but they are the support system for the breastfeeding. And I want to add to that. My mom was somebody who helped my husband and I with our daughter when I went back to work. So I actually had my mom come with me to my breastfeeding class, because I was a formula fed baby. And, my mom needed to learn, not from me, kind of all about breastfeeding. And I included her encouraged her to come to the class. And it was really great, because she then learned from an expert.
Not from you.
Not from me. Now she does. But, back then, someone else than her daughter telling her how we should be doing things. And it really did, I think, make my breastfeeding journey, once I learned how to breastfeed, I had a good support system. So if you have a mom along with that situation who's going to be helping you, it's probably good to have them come to the class also.
That is such a great idea. And I love that you took the dynamic out of it, that you're the one telling her about breastfeeding.
Yeah.
That you have this other expert that's teaching your mom. I think that's a really awesome idea. So yeah.
The other thing which is birthing classes. So many moms that I talk to are like, oh, I'm a scheduled C-section, so I don't need to go to birthing class. And I was like, oh, okay, well, let's talk about that for a minute. You want to still go to Lamaze, because, just because you're a scheduled C-section does not mean that oopsies and things happen before you make it to your scheduled C-section. Because my second one was a scheduled C-section, and I went into labor 2 weeks before that actually happened, and went and delivered. Hence, I got to the hospital late enough to where I didn't get to have a C-section. So having that Lamaze, knowing what my husband's allowed to do, what tapping or rubbing is okay and is not okay, was really important to learn. The breathing techniques. Just because you're going to be a scheduled or you've decided you're going to have an epidural, it's still good to know, be prepared for all situations. Even if you don't get to do that and you have to deliver it normally or vaginally or without anything, you'll be prepared. So I think classes are really good.
Classes are really good. More information is always better, always better. So take your childbirth education classes, take your breastfeeding classes. We know breastfeeding is so important. You know what I think is funny is that our childbirth classes, mine was like 2 months long every Monday night. And my breastfeeding class was like one time 2 hours. I'm like,
yeah,
labor and delivery is going to, I'm going to be there maybe 24 hours, right? Having this baby. I'm going to breastfeed for a year. And yet my breastfeeding class is like this tiny little amount of information. So I thought it was, the priority that was put on one versus the other. And maybe it's the fear factor. Like as parents, we want to have a lot of information about labor and delivery because that's really scary. And breastfeeding, we don't think of that as this big looming date that's gonna,
We don't. We think it's a natural thing, and it is. And we think that we don't have to kind of learn how to do it. And we kind of do. It's not just us, it's the baby learning too. So definitely, I think the more classes you take, the better. If they only offer you a one-time breastfeeding class, find another class so that you can actually have classes multiple times. That was a good question. Do you have any strategies? I didn't get to see all of it.
For comforting your crying baby. So that's a great question because you're going to learn about your baby's cycles. You're going to learn your baby's cues as days go by. So sometimes your baby might, like we talked about, put the fist in the mouth, and that's an early cue that they might be getting hungry. If you wait until your baby is actually crying, that's actually a really late hunger cue. Crying is a late cue. Chances are, if they're crying, they've tried to communicate with you a few minutes before about what's going on with them. So keep an eye on those little tiny things that your baby does that can indicate what's happening. So the first thing you do to comfort a crying baby is try to eliminate what's making them cry. So is it a wet diaper? Is it a cold breeze? Do they want to be picked up? Are they feeling insecure? Are they hungry? Do they need to be burped? All of these things are concrete things that you can do to solve the problem. And then sometimes babies cry and we don't really know why, and we try.
And there's solace that comes into play a little bit later. Sometimes it comes in about a month and a half to 2 months after, and you've learned your kind of cues of what's hungry and what's maybe a little gas. You've learned all that, and then all of a sudden it all changes, and now you can't seem to comfort your baby. You do have to eventually sometimes let them, as long as you've changed the diaper, if they're dry, they're fed, they're warm, let them lay down for a minute and try to cry that out. But I think all parents are going to find different ways. Sometimes your baby likes to be up on the shoulder and they like being up. They don't like laying down. Try to notice where in your holding of them they like it the best. If they like laying down more, then always try to stay with that strategy. But if they like being up, you kind of, just pay attention to that, because a lot of times they do like to be up and really looking at what's going on. And some moms I know have talked about that the only way they could comfort their baby was driving around in the car. I would suggest that be a norm, but some have put their babies in the bouncy seats and they're doing the, kind of that bouncing thing where they're really going, and they like that. A swing. I know all these little tools are out there for moms. Just really, like you said, pay attention to what seems to work, and don't, try to stick with what seems to work, and know that it's an ever-changing dynamic.
Yeah.
It actually what works now, 2 months from now is something new.
Yeah, that's so true. And we're getting a lot of great questions. And if you have a question, Tobi and I'll go back and answer your questions if we don't get to them here in the broadcast. I want to let you know we're having a product giveaway today, giving away 2 products. So the first one, and we'll choose the winner from the comments, is Milk Saver on the Go. So this great little product collects milk during the breastfeeding, or I'm sorry, in between the breastfeeding session. I'm so used to talking about the Milk Saver that collects it during the breastfeeding session. So we have one product that collects milk in between the breastfeeding session, and this is this one, Milk Saver on the Go. And then
I'm so excited about our Milk Saver on the Go because we have so many moms that have said to us, is there a way I can take my Milk Saver and wear it all the time? And I really feel like that's the answer that we've come up with, which is now giving you that opportunity to take your Milk Saver and bring it on the go, which tends to
Yeah. And so we're super excited to give this away to moms. This has been a product that has been years in the making. And the reason why we came up with it is because we had so many moms request a product like this. So we thought, well, let's give them what they're after. So this is something we're really
talk about some good key points about the Milk Saver on the Go. So moms kind of great.
Yeah, it holds a little more than 1 ounce. It's got a pour spout right here. So it's really easy to remove the milk. It's easy to clean. It comes apart into 2 pieces. And that's how you clean it. And then you just snap it. You're ready to go. You put it in the bra. The nipple fits through the opening here. And then when your milk drips, it just collects in the reservoir here.
Now, can we clean it in the dishwasher?
Yes, on the top rack. Great for nipples as well. You know, when we have those sore nipples in those early days, this is going to keep your bra or your whatever you're wearing away from that tender tissue. So it's great.
Let that nipple dry a little bit, which I think is sometimes what our big problem is with that. That's great. And then we're giving another product away. We're giving our nursing time tea. This is an amazing product that is, it's really something that kind of helps your breast milk production and helps increase and enrich your breast milk production. So I a lot of moms talk about how can I increase my breast milk? And there's lots of things out there. There's things like fenugreek and there's things like our nursing blend, but there's also the nursing time tea, which has a lot of natural ingredients that can help to, and have been known for a long time, herbs and supplements that can help increase your breast milk supply.
Yes. And if you comment, you're entered to win because we'll choose the winners from the comments. And if you don't win, just go to our website, mymilkies.com or fairhavenhealth.com and look for Milk Saver on the Go and you can order them. And they are really amazing. I'm really excited about them. I live here in Oregon and the Milk Saver and the Milk Saver on the Go are both made about 40 minutes from my house. So we try to keep everything as local. And so we're really proud of them. Anytime we have a new product, there's a lot of consideration. There's a lot of love and blood, sweat, and tears that goes into every one. So it's kind of fun when they're finally ready to go out into the world.
Yeah, and there are products that come, they're for breastfeeding moms and they are coming from breastfeeding moms. So that's what's great about our products with that, which is awesome. And we love doing giveaways. So we love all your comments. Like Helen said earlier, we're definitely all these questions. I see, oh my gosh, we have like 92 comments that we're going to be going back in and lots of interaction and replying to. Definitely, if you love hanging out with us and learning some things and sharing, please share our Boob Tube with moms that you think would be very interested in following up with our show, because we definitely do a show every month. We always have a different topic, and we love having interaction with all of you, as well as learning different things about being moms, as well as sharing our ups and downs about being moms.
Yeah, so we are just really excited to be here with you today and excited to see you next month for our next episode of the Boob Tube. So please watch for our questions, our answers to your questions as we go through after and answering your comments. And you can continue to comment and we'll go through and read those. And be sure to share. We're really passionate about helping moms on their breastfeeding journey, but also just the journey of being a mom. There's so much to it. I mean, definitely breastfeeding is one of those things that's in the early days can be extra challenging, but with the support and a great community, it actually gets a lot easier.
All right. Well, I cannot wait to get in and start having some answering because we've got all these comments we've got to catch up to. All right, guys. Thanks for hanging out with us on the Boob Tube with Helen and Tobi, and we will start talking back at you on those comments. All right. See you guys later.
Bye.
Bye.